Now I'm going to teach about kidney embryology from the book First Aid USMLE. So first we are going to learn about pronephros. So pronephros develops in the fourth week and then it degenerates. Okay. So next one is like mesonephros. So mesonephros is like it is also develops in the fourth week. Then its function is as intermittent kidney for first week in both sexes. So in first trimester that is 3 months. So here the fully developed kidney is not possible. Okay, so kidney matures and it completely develops at the 36 weeks of gestation. So here in the first trimester this mesonephros acts as kidney uh, in both sexes. Next one is like mesonephric duct. So this mesonephros, no. So here the mesonephric duct persists in males. Okay, so mesonephric duct persists only in male. So mesonephric duct, it persists only in males. It persists only in males. So as Wolffian duct forming ductus deferens and epididymis. Okay, so then the mesonephric duct in the female it degenerates. So here in females it degenerates and in male it forms ductus deferens and epididymis. The next one is like metanephros. So what is metanephros? So metanephros permanent. Okay, permanent development of kidney that occurs in metanephros. So here this first appears in the fifth week of development. Nephrogenesis is normally completed by the 36 weeks of generation or gestation. So already I have told you that complete kidney maturation and formation it takes 36 weeks of gestation. Okay, so the next one is like here we also have this one. So here, so this is pronephros. Pronephros takes 4 weeks of development and then it degenerate. Okay, so this is remnant of pronephros. Next one is like mesonephros. So mesonephros already we have seen that what happened in mesonephros. So mesonephros also it remains in males and it degenerates in the females. The next one is like the metanephrogenic blastema. So here we can see mesonephric duct is present. So in the mesonephric duct, stalk of ureteric bud occurs. Then that forms rise to metanephric diverticulum and metanephrogenic blastema is present. So this ureteric bud that is nothing but this metanephric diverticulum. That this is known as ureteric bud. Okay, this ureteric bud it is usually canalized in 10 weeks of generation. Okay, so in 10 weeks of development, it usually fully canalized, and this metanephric diverticulum it develops from the mesonephric duct. So from this duct, this ureteric bud develops. So from mesonephric duct, ureteric bud develops. The next one is like this ureteric bud also gives rise to ureters. So this ureteric bud we will get ureter, then we will get calyces. So you can see minor callus and major calyx. So this calyces also develops from the ureteric bud. The next one is like collecting duct. Okay, so next one is like collecting duct. So from ureteric bud, you develops ureter, you develops calyx, and collecting duct also develops from the ureteric bud, and ureteric bud develops from the mesonephric duct. Okay, okay, fine. Okay, so another thing is like so majorly we are going to see about now metanephric blastema. Okay, so this metanephric blastema, what it does? So here metanephric blastema, this is the purple color shade. So this is the purple color shade, and this metanephric diverticulum, just a pink color shade. So this metanephric diverticulum and this metanephrogenic blastema, they interact with each other. Okay, so they interact with each other. So hence it here differentiation of tissue occurs. Okay, differentiation of a tissue occurs. Hence, it leads to formation of glomerulus through DCT, that is distal convoluted tubule. So we know that nephrons, so structure of nephrons where glomerulus, tuft of capillaries are there, that glomerulus, and it also leads to formation of proximal convoluted tubule and distal convoluted tubule. So this tubule formation occurs due to the interaction between the metanephric diverticulum and a metanephrogenic plastima. Okay, so that's all about the usual uh, conditions of this um, embryology. So now here abnormal formation of renal structure. So these are the normal formation. So suppose abnormal formation of renal structure leads to congenital conditions such as, so here aberrant interaction between the metanephrogenic blastema and metanephric diverticulum. So this is metanephrogenic blastema and this is metanephric diverticulum. So here normally it differentiate to form glomerulus and DCT. So if suppose if they fails to interact with each other, that leads to renal agenesis and multicystic dysplastic kidney. Okay, hope you understand the embryology part. Stay connected. I will upload further.